One of the big reasons why I wanted to do this free nonprofit COVID-19 course is there's a lot of organizations out there that are still serving clients in the COVID-19 crisis because they have to. And many of their people that are putting their lives at risk, and it's probably going to be at even more risk, and they're trying to minimize the risk. And I want to share, as of today, what are some of the resources that are available for these organizations. So the type of organizations that I'm describing are those like homeless shelters, recovery programs, ministries and organizations that provide critical services. I'm not trying to cover hospitals or businesses providing critical resources. They're going to have better tools elsewhere. And I just want to share some of what other ministries are doing. So, I think across the board, they're screening clients with questionnaires. They're taking the temperature. And let me also just explain, if you're running a homeless shelter, then you can't just send everyone home. It's in many ways similar to a hospital. And if you send everyone home from a hospital, that's going to be problematic. So they're facing, difficult circumstances, and the homeless also are a group of people who are most at risk for getting the coronavirus and of also spreading it. So what a lot of ministries are doing and organizations that are serving the homeless are doing is they're screening clients with a questionnaire, taking temperature. They're trying to adjust their housing. So if they have anyone who has potential symptoms, people who might be sick, having a quarantine dorm, special housing for elderly or others at risk, and then setting up rooms to improve social distancing. So isolating rooms, providing more space, things along those limiting, number of people there. Another thing that a lot of ministries are doing is they're not serving more warm meals to the public, maybe only residents, or maybe completely switching to bag meals to reduce health risk. So they're essentially, if you have a soup kitchen, they're going to the equivalent of takeout. Staggering meals, if you continue to have people there, so you have them in smaller groups and then you spread out the chairs more. And then maintaining the food pantry, but trying to keep the boxes at the door. The other things that groups are doing, disinfecting crews for all guests and staff areas and having them properly trained with, CDC guidelines and the right tools, installing hand sanitizer stations at entry points and other locations, posting signs and providing training on CDC sanitation recommendations for people at the mission. Other things, so staffing, programming, volunteers, what a lot of ministries are doing at this point. And right now, whenever I'm recording this, is a lot of places are still under the stay-at-home order or quarantine. Is that people are staying home with any sign of sickness and giving extended sick time to part-time employees. Non-essential staff and those over 60 are working remotely. Limiting or shutting down volunteer service programs. Shutting down non-core services and community-facing programs such as youth ministry or thrift stores. In some cases, doing virtual case management from a computer lab for those in residential recovery programs, discontinuing all outings and family visitation, and stopped accepting new clients from long-term recovery program temporarily. Some rescue missions have said that this will cost them an extra $100,000 a month of just, having these extra sanitation capacities, but they also are expecting a significant drop in donations across the board. So what is recommended if there's a confirmed case of COVID-19, ultimately you need to work with your local health official. So that might be a health director for your city. And follow whatever they say. I'm not going to be the expert on here, but I'm just telling you here's where you need to go, because we've actually worked with thousands of ministries, and we're going to pass this on to our network. And some may have not have heard this advice. So have a plan to transport guests that might have COVID-19 symptoms to a healthcare provider. Have regular conference calls with the local health department and officials. Have a plan for a shelter lockdown if that directive's given from a local health department in case someone, there's a COVID-19 outbreak. Be prepared to go to shelter in place and have, 24/7 rotation of staffing. Longer term, you a lot of rescue missions and Christian homeless shelters may need to seek partners for additional quarantine locations. And you'll have to work with the government on this, whether it's hotels or camps or other places. There have, as of last time I checked, there is one homeless shelter that had identified COVID, or actually two, one in Tacoma, Washington, and one in New York City that had confirmed clients. And we're likely going to have many more. And I just want to say, if you are at an organization that's serving those, I mean, you're like people in the hospital, and they're going to do everything they can to protect you, but there's also risk, and we realize that there's risk, and it's mainly to people who are age over 60. But I think for many of you in this crisis, there's going to be you're acting as similar to the first responders in September 11th, maybe not quite the same direct risk, but over the period of a year, I think we're going to see a lot of heroes emerge during this time. So some additional resources. So this COVID-19, this is a part, if you're watching this on YouTube, this is a part of a free course that is at nonprofitcovid19.org. And we have also a bunch of free course playlists on YouTube that's going to be available there. We have City Vision courses that align with this session. But I also want to show you, we have a toolkit particularly for this section. So in the toolkit, we have resources for organizations serving the homeless and high-risk clients. And we have a lot of links here. So there are a lot of guides for those who are working with the homeless, the United States Interagency Council on the Homelessness. Citygate has one of the best toolkits out there. They've made that available for free. Salvation Army is documenting their response. There's a lot of good resources here. So I would encourage you to check it out on our website. Thanks a lot.